Hello, I'm Dr. Jayashree Shah, consultant hepatologist and gastroenterologist. I take special interest with liver diseases and hepatobiliary conditions. Now, today I would like to spend some time talking to you about an important question, really, which I'm asked very frequently in my practice. Can you have liver disease with normal liver function tests? We normally use the word LFTs to describe that. And the answer to that question is yes. Many times we think that if our liver function tests are normal, everything is fine with the liver. You will note that liver disease is actually it's the largest organ of the body, and it is most of the time you detect problems in the liver incidentally without feeling any symptoms. So it's completely asymptomatic. So, what are the tools available to assess liver disease early? We have ultrasound of the liver, which is a very useful tool. It's non-invasive, doesn't cause any discomfort. Similarly, nowadays we have fibroscan or ultrasound elastography. This takes away the need for more invasive assessments such as liver biopsy, and this can tell us if you've got scarring of the liver without having to put any needles in your body. So it's a very good test to tell us about your liver health. And of course, most are familiar with blood tests and panels of non-invasive liver screen that we offer to look at variety of liver conditions, which can either be inherited, and therefore family history is important, but also a number of risk factors that we've already talked about, which can be silently putting you at risk for liver disease. Let's talk about an example such as fatty liver. Fatty liver simply means fat deposition in the liver. Normal livers have less than 5 to 10% fat. If you've got more than that, that is a fatty liver. And there are a variety of conditions that increase your risk to cause a fatty liver, from alcohol, which is one of the common factors, to non-alcohol fatty liver, which can be if you're overweight, diabetic, if you've got cholesterol, hypothyroidism, and these go on silently causing fat and inflammation in the liver and scarring. Now, during this entire process, your liver function tests may be entirely normal because at the end of the day, these are blood tests. They measure enzymes and proteins, and you may have just caught that blood test at a point in time when the inflammation was not there, and then it is deceptively normal. So it is important to understand that you can pick this up incidentally, and it should not be ignored. Other conditions such as hepatitis B, C, very silent infections. A number of people are at risk of having this infection if somebody's had it in the family. If you've had blood transfusions before 1989, these are spread through blood products, and sexual route, tattooing, invasive procedures. So it is important to assess yourself if you have any of these risk factors, because you might not feel any symptoms from these infections in the early stages. Likewise, alcohol is something that we use very frequently, and sometimes we slip into higher intake, which can silently affect the liver. So what I'm really passionate about as a liver specialist is to detect liver disease early, like hit hard, hit early before it's too late. So if you identify yourself as having any of these risk factors and would like to know more about your liver health, I'm happy to help and provide clarity.